In this video, I am going to discuss about the anatomical landmarks on OPG. Before going to that section, let's discuss about the indications, advantages and disadvantages in short. OPG or orthopantomogram is used to evaluate the complete dentition. We can examine gross intraosseous pathology like cyst, tumor, malignant lesions. It also useful for gross examination of TMJ. Even we can evaluate the position of impacted tooth, dental maxillofacial trauma and developmental disturbances. Now some advantages. It shows entire dentition in a single image. It is very useful if the patient has a trismus or difficulty in mouth opening or gagging problems. Radiation dose is relatively low, almost 1/3 of the dose from a full mouth survey of intraoral flames. It needs very little patient compliance. Now some disadvantages. It has poor diagnostic quality in comparison to other radiographs. Then unequal magnification across the image can make a linear measurement unreliable. Sometimes superimposition of anatomic structure can obscure the diagnostic information. Anterior teeth are poorly registered, so sometimes it is impossible to comment on that section. Artifacts are more commonly seen and easily misinterpreted. Now here you can see an OPG. First of all, we will see some common bilateral anatomic structures. Here, this is condyle. Below the condyle, this concave depression is called sigmoid notch. And here, this is coronoid process. Now these box-shaped structures are cervical vertebra. Here you can see a bony process. This is styloid process. And here, this is the impression of hyoid bone. Now here you can see a radiolucent bony canal present bilaterally. This is inferior alveolar nerve canal. And this small round radiolucency just apical to the second premolar is mental foramen. Now come here. You can see these two big radiolucent structures. These are maxillary sinus. Here, just over the apex of the root of the posterior teeth, this thin radiopaque corticated line is the floor of the maxillary sinus. This is medial wall and this is posterior wall. Now the gap between the posterior wall and this pterygoid process is called pterygomaxillary fissure. This is an important anatomic landmark in diagnostic point of view. This anatomical landmark is lost when a maxillary lesion involves the posterior wall. So with careful observation, we can say if posterior wall of the maxilla is involved or not. Here you can see a small bony canal. This is infraorbital canal. And this radiopaque bony structures is zygomatic arch. Now here this radiolucent structure is nasal cavity and this is nasal septum. Here this radiopaque line is the shadow of the hard palate and this one is the shadow of tongue. These radiopaque structures just adjacent to the condyle is articular eminence and this circular area is orbit and this bony prominence just posterior to the third molar is maxillary tuberosity. Like this video and don't forget to subscribe the channel. Thank you.